Runs on the posterior surface of the popliteal artery. Okay, we got only 3 minutes. Fine. Okay, great. Pierces the oblique popliteal ligament and supplies the capsule of the knee joint. Okay. Posterior surface of the popliteal artery. Okay. Genicular branch. Posterior surface of the popliteal artery. That is superficial to that. And then pierces the oblique popliteal ligament and supplies the capsule. It supplies the capsule of the knee joint. Okay. It supplies the capsule of the knee joint. That's it. And then moving on forward, we got anastomosis around the knee joint. Again, quite anastomosis of the knee joint by the, it's also called as genicular anastomosis. Okay, so the genicular anastomosis is an arterial anastomosis. This is not in relationship with the nerve, but rather to the genicular arteries, the 5 genicular arteries that we know. Correct? So the genicular arteries is an arterial anastomosis around the knee joint formed by the branches of the popliteal, anterior tibial, posterior tibial, femoral and profunda femoris arteries. Okay, it has nothing to do with the genicular arteries. It has nothing to do with the genicular arteries. What exactly was the genicular arteries? It was a division of the popliteal arteries, right? Right? It was the division of the popliteal arteries. We have muscular arteries. We have got muscular arteries which supply the various muscles, right? Soleus, popliteus, and then plantaris, and then the popliteal, the gastrocnemius, and all it supplies all of it, and then right, and then the anterior part is going to do that, and then the posterior is going to supply this medially, this is going to supply laterally, this is going to supply. So we got the cutaneous, we got the muscularis, and the 5 genicular, right? So now it is going to be divided by the popliteal branches, and then it's going to have the anterior tibial, the posterior tibial, the femoral and the profunda femoris. So it helps in the, this is very important, it helps in the blood flow during flexion of the knees. Okay, during the flexion of the knees, it's going to help in the supply of the blood flow. So okay, so what are all the parts that form this anastomosis? Is it's going to form the genicular branches. According to the name, genicular branches form a major part of it. What are all the genicular branches? From the femoris artery, the femoral artery, the popliteal artery is going to come, and from there itself a genicular branch is going to come. So a descending genicular branch, and then the 5 branches of the popliteal artery, and then we got the descending branch of the lateral circumflex. Okay, the lateral circumflex, and then the anterior tibular, and then the posterior recurrent, which is a part of the anterior tibial, and also the circumflex, fibular circumflex, which is the division of a posterior tibial.